My brother was diagnosed with glioblastoma tumor, and I started visiting him in California. And after the removal of his cancerous tumor, I started realizing I was having some issues with myself. Felt like a light pulsating headache, but it wasn't painful. A little bit of pain in my calf, and my neck was just bothering me. I saw my chiropractor. After about a month, he said, "Stella, I'm really good at adjusting necks, but for some reason why you're still having some issues and not getting any relief." He says, "I highly recommend you get an MRI." After about 2-3 weeks, I went ahead and agreed because the pain was just too painful. He calls me up a couple days later. He says, "Stella, you're right. You have some neck issues. You have 2 bulging discs, but in addition to that, you have a tumor."
Spinal cord tumors fall into 2 main large groups. One in the canal, which is what's called intradural extramedullary, but it's inside the covering of the spinal cord, and then pressing on the spinal cord from outside. And then another one is intradural intramedullary, where the tumor is within the covering of the spinal cord and then within the spinal cord substance itself.
And he explained the longer it stayed in me, it's going to press more and more against my nerves, and that's why I'm going to start to have more and more problems. Dr. Cattorini, if I was your wife, what would you suggest? And he said, immediately take it out, and that's exactly what we did.
This is a model of the back of the skull, and then the front of the neck, and then the back of the neck. Stella's tumor was within the spinal canal itself. It was actually within the spinal cord itself. It was at the C3, C4 level, and these are lamina that were removed. We removed 2 of the lamina, making a small incision, localizing it here, opened up the covering of the spinal cord, and then went directly into the spinal cord itself to remove the tumor.
I just feel confident that whatever I had or whatever I may get in the future, I know I would always rely on him or go back to him.